We have in front of us the necessity of great changes because more and more we need to treat the person outside the hospital, recover the patients from the hospital is very expensive. This is not a local problem, but is a European problem. In the last years, an increasing number of persons decided to do not treat and care themselves, principally for economic reasons, where we need to increase the correct indication for exam and visit, but also we need to intercept the person who renounced to give up the treatment for economic reasons. As I said many times, our system is a good system with great professionists. Region decided to put a lot of money on sanitary field. Sure, for extrinsic reasons, there are many difficulties. The real necessity we have today is to take decision on what is necessary and what is not necessary. If we will take this decision that may be also politically difficult, then we can concentrate the resources in a lower number of hospital, but of high level and with more quickly answer to our patients. So sure, we have many difficulties, but these difficulties are less than other region, and with correct decision we can overcome this moment and maintain at that level our system.